Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
I am at an organizational meeting. And while I'm at that meeting, I come across an interesting lady who is listening to me and hearing all the things that I'm talking about as I was emceeing this function. And she said, you know, you're an interesting guy in how you do all of this. And I understand you have a TV show, and I would like to know if you'd be kind enough to get the word out about my organization. And I said, well, what's your organization? And she said, it's an organization which helps people with heart problems and stroke victims as well. And I said, well, sure, what is this? And she said, it's the American Heart Association. I said, are you kidding? I'd be thrilled to help you. So she introduced me to a gentleman who has a fascinating story to tell. It's fascinating because you will probably relate to it personally, or someone you know. Worse, maybe something in the future could happen to you, and by hearing about this now and learning more, maybe it could save your life. So I'm going to introduce to you Bill Fischer, who is a member of the board of the American Heart Association, who's here today to explain to us a lot of things about what this organization does and great information, great tips that, who knows, maybe Bill can help you save a life, your life. Bill, did you like that opening?
Thanks, Doctor.
That was good.
Pleasure. Very
Thanks for taking the time to come down to help us here. And I know you traveled. Oh, it's terrific. I know you traveled a great distance to get here. I know you're right around the corner, which was fascinating. Bill, you had an interesting problem that came your way, unfortunately. Tell us, before we get into American Heart Association, let's talk about Bill Fischer.
Sure.
What happened?
Father's Day, 2005. I was at a soccer tournament for my middle daughter, and I started feeling extreme discomfort in my chest, to the point where it actually got very painful. And I said to my wife, I'm like, there's something the matter. And she's like, what's the matter? She's like, I don't know. I'm like, I'm having some really bad chest pains right now. And she's like, would you like to go to a doctor? And I said, yeah, I think it would be a good idea. So we proceeded to walk towards the car, and as I was walking towards the car, the pain got very, very intense.
Even more than it was.
More intense than it was, to the point where it was
incapacitating.
Incapacitating, exactly.
Where was the pain, Bill?
Emanating really from the center of my stomach and the lower chest region, and then slowly going up through and up into my throat. Made my jaw hurt. Really, the way to describe it, felt like somebody was sticking me with a sword right through the center of my chest and turning it, exactly.
Did you feel it radiate?
Yes,
it was just linear.
It was a radiating pain up and through my neck and my throat. Felt almost like a grapefruit was stuck in my throat. It was really it was very uncomfortable.
Was there an acidy type feeling also?
No, I think what sealed the deal for me was the cold, clammy sweat. My father described his heart attack. I do have heart disease in my family.
Talk about that. We discussed this before the show. Discuss this. This is important for people to know this.
Yes, my grandfather, who I never met, died when he was 51 years old at his job with a massive heart attack. My father, who when he was 46 years old, had a similar type of a heart attack, but he was, thank God, survived. So I had all of the symptoms described to me by him. And it basically progressed the same exact way his did. The pain in the chest, the lightheadedness, the shortness of breath, the pain radiating into the left side of, the left arm down from the shoulder and on down, and the numbness in the fingers. But the cold, clammy sweat's what did it for me, because he made it a point. He's like, I got soaking wet in seconds. And that's exactly what happened.
You were getting soaking wet in seconds.
I was soaking wet on a very cool morning in June. I was sopped like I had just done a workout. By the time We had gotten to the last soccer field right before the parking lot. I was on the ground writhing in agony, had no idea what was happening. I told they had called an ambulance. My wife was hysterical, looking for anybody to help me. And some woman came running over. She's like, I'm a doctor.
Ooh.
She's like, what's the matter? And I described what was happening to me. I told her I was having a heart attack. She immediately sent my wife on a mission to go find an aspirin, really more or less to get her away for a second because she was in hysterics at that point, so she wasn't really helping the situation. She came back with an aspirin, believe it or not, within seconds or minutes. At that point, it was hard to, time was sort of like...
Did you chew it?
No, somebody gave me a water and I put it right down.
Because I was told you're supposed to chew it.
No, I swallowed it with a glass of water.
Yeah.
The best part, I guess, besides her giving me the aspirin was someone else noticed what was going on.
Yes.
He happened to be a paramedic.
Boy, you lucky.
So he was one of the assistant chiefs of the Malvern Fire Department, and he, by the grace of God, had his rig right on the other side of the fence.
Go away.
So he had his medical bag, he had oxygen, he had a defibrillator.
Oh, my God.
He had everything there. So it was essentially the ambulance had arrived before it really got there. So they were able to start the treatments of nitroglycerin just to open up the vessels and give me a little bit of dilation. It helped with this discomfort temporarily until we got to the hospital. Was immediately taken to North Shore in Plainview, where they diagnosed and confirmed that I was having a heart attack.
Mm-hmm.
Doctor told me we were going to be shipping me over to North Shore LIJ in Manhasset. There's a stent lab, catheterization lab.
Right.
And basically he said to me, he's like, just stay calm, and he's like, we're going to probably put a stent in your heart and clear up the blockage that's causing your heart attack. Now, at that point in time, he was doing his job of keeping me calm. I really had no idea the severity of the issue until it was all said and done, believe it or not. I mean,
the severity of the issue was
how bad it was.
How bad was it?
Left ascending artery, main artery to the left side of the heart was 100% blocked, which 20 years ago, without this technology, that's been
dead.
I would have died. I would have been one of those statistics as a guy who died under the age of 40 from a massive heart attack.
So you were how old at that time? 39?
39 years old.
39 years old. Now, what condition were you in? Were you big and fat and eating, pastrami sandwiches all the day and washing it down with, lots of soda and beer?
Nope. I was actually in the best shape of my life. I was under 200 pounds, about 185 pounds. I was running the mile in under 9 minutes. I was actually training for the Chase Corporate Challenge not 2 weeks before. And
so he was chasing you? Go ahead.
Nah, it was it's the 5K race that they had out at Jones Beach, and my goal was to do it in under 30 minutes, which I had achieved that time,
right.
Just through practice runs, and really it was. I don't know. It's hard. They really can't give me a definitive answer as to what caused the heart attack, other than
genetics.
Other than genetics contributed to it, and then a plaque sac that was in the heart artery, the arterial artery, ruptured probably, and caused the blockage. It was sort of described to me as almost like a flypaper situation. All of that
stuck together,
oozed out, and the flap that was caused from the rupture probably just grabbed every single thing in the bloodstream as it went by and very quickly closed up that artery in the heart, which caused the heart attack. What caused the plaque sac to rupture? We can sit here all day long.
Doesn't matter. So, first of all, I'm thrilled and happy that you're here to talk to me today.
Yeah, I am too.
Okay? It's nice to know that. Now, give this transition. How did you go from victim, heart attack victim, to survivor, to now a board member of the American Heart Association? Give us this trail.
Sure. Upon going back to work, I'm a partner in a major CPA firm on Long Island.
Right.
So there's a lot of people that I deal and do business with on a daily basis. When they all heard I had the heart attack, there was a few people on the American Heart Association board who asked me if I'd like to get involved. And I was like, well, in what way? He's like, well, we would like you to be our honoree for our gala. Our West End Gala. And I'm like, well, what would that entail? I'm like, simply just getting our message out there and helping us raise money for the gala.
Right.
So between myself and my partner, Lou Grassi, we We put on a nice fundraising campaign to help raise money for the Heart Association through the West End Gala. And we gathered all of our friends and our associates in business who I'm very close with, who were very touched by the entire situation. I had a lot of clients that were very scared that, what happened to my accountant? My accountant's gone.
Right.
Right. So we used that as I was the survivor story, and we used that to help raise money. And I tell you, we did a wonderful thing, and we raised over $100,000 just from our.
That's fantastic. So now let's shift into the American Heart Association.
Sure.
Because that's the story of how you got to go there. The American Heart Association, what does it do?
Well, essentially, it's a volunteer organization that promotes wellness and overall better enhanced quality of life for people, and tries to educate the general public on what heart disease is, what stroke is. It is the #1 cause of disability and death in the United States.
Is heart attack or heart disease, coronary disease, and stroke?
Yes. Over 900,000 people a year die from either a heart disease or stroke.
Those are staggering numbers.
Yes.
Staggering numbers. Unbelievable. Now, the association tries to enlighten people, to educate them. But
Yes.
don't they also try to do things with research?
Yes. The American Heart Association gives over $470 million a year towards research and awareness campaigns to reduce the effects, the devastating effects of heart and stroke. Like I said, if it wasn't for that research,
Right.
stents would not have been invented.
Right.
I wouldn't be here talking to you today if
Right.
it wasn't for that.
Well, I know the importance of American Heart Association in a lot of things they do, but as a dentist, I know that when I treat a patient, for example, and we want to protect them against subacute bacterial endocarditis, which is a severe debilitating disease that can kill you, from bacteria getting into the bloodstream and then lodging on one of the heart valves.
Sure.
So we've always, through the American Heart Association guidelines, given antibiotics before treatment to certain patients, and the guidelines have changed recently, but the American Heart Association is a very important entity in the United States.
Yes, it is. I actually have my own prescription because I do have to go to my dental appointment next week.
Aha.
So I know exactly what you're talking about.
It's essential. It's very, very, very important. How was it created, the organization?
Probably just after the turn of the century, a bunch of surgeon, cardiovascular doctors got together to try and promote I guess what was considered to be a doom type of a situation to the people who have heart disease. They were basically relegated to bed rest.
Right, it's true.
They were trying to organize, they got a national organization together, and they shared all of their research and their findings, and they were promoting for further studies. So the 6 cardiologists that represented several groups founded the American Heart Association in about 1924.
That's interesting. I didn't know that. Is there a goal that you have right now for the American Heart Association?
Yeah, I think our main goal is to reduce coronary heart disease by about 25%.
Good luck.
We're doing very well with it, though.
Good luck. I mean, you come up against, look at the ads. You got obesity today among kids.
Yes.
They're eating such garbage food, and you got on television being pounded in the face by eating this full of sugar,
Yes.
and have this cereal. And
Exactly.
sugar is just leading to kids on to this incredible obesity.
Yes, we're trying through the Clinton Foundation, the Alliance Against the Childhood Obesity. We're teaming up with them to try and help promote the awareness in parents because really a lifestyle started when you're a young child is usually a lifestyle that you stay with for the rest of your life. So if you're constantly in the mode of eating fast foods,
You'll be stuck with that
you'll
junk.
be stuck with that junk for the rest of your life, because that's really the only thing that you were taught to eat, as opposed to eating healthy, maintaining a healthy lifestyle,
Right.
Maintaining an active lifestyle.
Right.
I will tell you, I was a smoker for 20 years.
You were a smoker?
Yes.
Oh.
I was probably 20 to 30 pounds overweight for the better part of my adult life after I graduated high school. It was sort of an amazing awareness. I went to a cardiologist when I was 37 years old, and he said everything was fine. He's like, lose 20 pounds, stop smoking, and you'll live forever. I did both, and it still happened anyway. But
Did you yell at him?
No, because you know what?
Kidding you.
That man probably saved my life right then and there by telling me to lose 20 pounds and stop smoking, because the severity of my heart attack, had I been in poor shape that I was when I was 25, 30 years old, I probably wouldn't have survived the heart attack. I had built up enough heart muscle that I actually overcame the effects of the heart attack, to where, while the damage was severe, I still had enough heart muscle left over.
Interesting.
Compensate.
Before we continue, I'm going to ask my crew to put on the screen right now, just if you can, the graphic showing the website of the American Heart Association.org, I believe.
Yes.
But will be on the screen, and the phone number as well for the Long Island chapter of the American Heart Association. I believe that's the number we're using. So we could have that on there. So every now and then, I'm going to ask you just put it on, at your decision, so people can see, they can get more information. I'm sure there's a wealth of information on the website.
The information on the website is an education campaign for everybody. Okay, there are things about heart disease and stroke that I'm sure people don't know about.
Stop. Let's talk about stroke. We've been skirting it, because the American Heart Association / American Stroke Association is one organization.
Yes, it is.
Okay. Briefly, what's a stroke?
A stroke is simply, instead of a blockage in the arteries of the heart, these are blockage of arteries that lead to the brain.
Right.
Okay. Number one cause of stroke, or probably the number one causes of heart attack, lifestyle. High cholesterol. They all have the same factors as far as what leads up to either one of them.
It's still a plug.
Yep, exactly.
And everything you're discussing causes the plug. Yes. And it depends where the plug's going to be. It's going to be in the brain, stroke, be in the heart. So the organization shouldn't be called the American Heart Association or the American Stroke Association. It should be called the American Circulatory Association. Because these diseases are caused by, these end results are caused by diseases of the circulation.
Sure. It's all cardiovascular at the end of the day.
You can get a plug into the kidney also. And you wind up getting an infarct to the kidney, which is a kidney attack.
Yep. There's also peripheral arterial.
There you go.
Which affects the legs and the hands. People, getting numbness in your fingers
constantly.
Neuropathy. It affects just about any part of your body.
Right.
And the root causes go back to. There is no single one factor. It's a combination of things.
So let's talk about those factors.
Sure.
Some of the factors are let's lump stroke and heart attack in one thing, just called cardiovascular or vascular incidents. What are some of the factors? You mentioned them briefly earlier, but let's hammer it again.
Sure. High blood pressure. Okay. Because the heart's working harder, over time, it's going to cause the heart to weaken. Okay. Tobacco smoke.
Okay. We all know.
Number one probably factor in coronary heart disease. Again, I was a smoker for 20 years, as was my father, as was my grandfather. Okay. We all caught religion. Unfortunately, my grandfather never caught the religion. He died before he could. My father caught religion, 46 years old, 3-pack-a-day smoker.
Wow.
Stopped cold turkey after his heart attack. Did not have another one. I fortunately stopped my smoking 3 months before the heart attack. I had gone cold turkey, did it, was very happy with myself, proud of myself, getting into shape. So everything was going great. I will tell you that the risk of a heart attack in a non-smoker as opposed to a smoker is doubled. Okay.
Doubled. That's a big statistic.
That's a telling statistic for people who don't believe cigarette smoke is bad for your health.
How could you not today? You got to be out of your mind.
You'd be crazy not to think that. High blood cholesterol. What I think is a big item, physical inactivity, because in other words, this is a lifestyle. If you like to exercise, that's great. Okay. People sitting around all day long, the couch potato mentality. Those people are at a higher risk because they're not getting the blood circulation through their body and not working their heart muscles and keeping their heart muscles strong. It weakens the heart. Obesity and overweight, which go hand in hand with physical inactivity. Diabetes, also another big...
Well, when you say obesity, overweight, that immediately takes you into diabetes because you really run the risk of becoming diabetic.
Okay. There's a few things that you can't control. increasing age, obviously.
Appetite? No, I'm only kidding. Okay.
Certain races are more
Prone to it.
African Americans
Absolutely.
are more severe high blood pressure than Caucasians. Mexican Americans, American Indians, Native Hawaiians, just based on the way their dietary habits, and then hereditary. You're sort of born with it. You can be born with heart disease. There's nothing, and again, the only thing that you can do to prevent it is to control the other risk factors. Okay, and also see your cardiologist on a regular basis.
You know, that is such an important thing. Understanding the risks and then going for a checkup. I like when I speak to people, patients come in, and I say, I look at their medical history, and I said, now, when is the last time that you had a checkup from your physician? Oh, I'm okay, doc. No, when was the last time? Well, 5 years ago, 8 years ago. I said, no. You're supposed to go routinely. How do you know? The biggest silent killer of people is high blood pressure.
Sure.
You don't know you have it until it's too late.
Exactly.
So people should get checkups, get blood work up, get all of this done all the time. And they can access more of this information on the American Heart Association website.
That's
Is that correct?
That's correct.
So you have a lot of that. Okay. So you're mentioning all the important things, smoking, eating like a gavone, and just...
There's one other law. There's one other big thing that,
and
I think it's the way it affects me, and I think it had a big thing to do with my heart attack.
What?
Individual responses to stress.
I knew you were going to mention that.
Okay. I'm a partner in a CPA firm. I deal with stress every day. When you're the boss, everybody's got their own responses to stress. When you're running a business and you're running, that's maintaining a certain lifestyle, there's a little bit of stress involved there. And I will tell you, it gets to you, and how you respond to that will dictate how it affects your health.
Such a key issue you just raised. I did a study years ago at a hospital. We talked about the nature of pain. And did you know there are two aspects to pain? And this relates to what you just said about stress. There are two aspects to pain. If you get pinched, first is you'll feel it. And then second, what are you going to do about having received this feeling? Normally people go, ooh, ee, they respond by screaming. There's a part of your brain that stops you from reacting negatively. Yes, you'll feel it, but you won't scream and get all upset. Exactly. If that area, for example, if you give somebody a tranquilizer, it goes to that part of the brain, so it quiets them down. Exactly. Well, it's the same thing when you go to work. And if you have a problem, you understand you've got a problem, and you got to deal with it and fix it up. But if you add to it, and you make yourself sick, and you start getting upset by it, that's not going to help you get rid of the problem.
Nope.
All it's going to do now is take your blood pressure, raise it. It's going to get your heart upset. It's going to make you eat. It's going to do all sorts of ridiculous things, as opposed to just dealing with it. So learning how to deal with stress is a critical factor, whether it's pain or whether it's stress on the job.
I agree 100%.
I agree with everything that you're saying. Tell me a little bit about what the American Heart Association is doing for women.
Well,
and why? I mean, what's the big deal?
Well, why is the big deal is that heart disease and stroke are the number one causes of death in women. Okay,
a lot of people don't know that. Let's say that
people
again.
Do not
Repeat
know
that again.
The number one cause of death in women is heart disease. Okay, and stroke. No other way. It's not breast cancer. It's not cervical cancer. It's heart disease.
Why is it that when you think of a woman dying, you don't think of that? Did you think of this before you got involved with the organization?
No, I didn't. One of the things, I guess it's different, is that heart attacks affect women differently than men.
Can you explain that?
Sure. I mean, I'm not a doctor, and I don't know why, but I do know women can have a heart attack and not even know they had one.
Really? Okay. That's because they're always putting up with their husband, and they're used to the pain. Go ahead.
Probably.
And don't forget the kids.
I don't know. For some reason, it affects women differently. The pain is not as intense sometimes. I mean, and again, it could be different in everybody here. But I do know several people who basically had a heart attack and didn't know it until 6 months later when they went for a regular checkup.
Oh, my gosh. So American Heart Association is trying to create greater awareness right now?
Yes.
And doing all of that. And we have right now a poster that one of my crew can get a shot of it, this big, beautiful red poster that's behind you. Let's see if we can get a shot of that. And it says, how do you go red? I will make my health a priority. I will schedule and keep a doctor's appointment. I will be here for my child's wedding. I will take the time for myself. I will celebrate my successes. You have the power to go red. Visit AmericanHeart.org. So I think we have that on the excellent. So this is relating to women. I see it's like in a picture of obviously a dress.
Yes.
Which is terrific.
Yes, that's the symbol. We to show that you are a proactive in the Go Red campaign.
Right.
We hand out all of these different pins for people who wear. I'm wearing one on my lapel.
Oh, great! I'll be proud to wear this with honor.
It's a symbol that you support the Go Red for Women initiative that the Heart Association started several years ago.
Right.
It's really, again, it's part of their awareness campaigns about heart disease.
Let's see if I can get this on a camera. If we could get in there and wake up my cameraman. Wake up. Okay. Yeah, he was watching another TV show probably. But anyway, you see this, which is really so. You wear this in your lapel, and people looking at it should gain awareness and understand. Hey. Yes. Let's take care of our ladies.
Exactly.
Thank you.
There's also a website for that. It's www.goredforwomen.org to give you additional information on how you can participate. Again, it's not just an awareness campaign. It's also to help raise money for the Heart Association also.
Which is great, which you exist by donations, obviously, as a not-for-profit organization.
Strictly donations and fundraising.
I think that's terrific, and I think doing a show like this gets the message out about the importance of the American Heart Association and how the association has helped so many people through the years. I think this is absolutely terrific. So this has become your mission in your life and your goal.
Yeah, I hadn't, throughout my career, I've helped different causes and gotten involved with different things, but never really to the extent that I've gotten here with the Heart Association. It's close to me. It affects me personally.
Mm-hmm. So the association probably did some things years ago, for example, helping to promote the stent.
Yeah, the research that they came across.
You wouldn't be here otherwise.
I wouldn't be here. I mean, there's so much. There's only so much time you have when there's a blockage that I had. I didn't know that until afterwards. Every doctor comes to you and says, "Wow, you're very lucky to be alive." Every single doctor that I've ever talked to, because there's a little that blockage for that artery is called the widowmaker.
I don't want to hear that.
There is nothing. 20 years ago, there was nothing anybody can do for that.
We have 1 minute left. In that 1 minute, I want you to just tell our viewers through me what they should do. End it by saying, "This is what you got to do."
If you smoke, stop smoking.
Go ahead.
Okay. If you eat unhealthy, start eating healthy.
Go ahead.
Okay. If you don't exercise, start exercising.
Okay.
Okay. And just be aware of your family history and go see your doctor at least once a year for a physical checkup. And if you've got family history with coronary heart disease, go see a cardiologist.
What you don't know might kill you.
It will kill you.
People want to stick
there.
It will kill you.
It will kill you.
Boy, you went through some frightening experience.
Yes.
Probably the most frightening moment of your life.
It was. It was in front of my kids.
Your kids were there?
Yes.
Ooh, boy, oh boy, oh boy, oh boy. I got two little guys, too.
Mm-hmm.
Unbelievable. Bill Fischer, you're amazing.
Thank you very much for having me.
I'm thrilled to have you here to spread the word, get the word out on the dangers of this and why people need to take care of themselves and how the American Heart Association is acting as that vehicle.
Yes, it is.
To get the word out, and it's essential, it's important. Will you come back again?
Whenever you want me.
Okay, and will we get other people from American Heart, some doctors,
yes,
to come down so that they can talk?
The organization is full of wonderful people, okay, that are just there to help. Again, this is a voluntary organization.
Right.
Okay, nobody really gets paid to do this.
Right.
Okay, we're here to spread awareness and spread the campaign. Okay, that heart disease is the #1 killer, along with stroke, of people in this country and worldwide.
Unbelievable. Come after the show, you and I'll go out and have an ice cream. We'll talk about it.
Okay.
Terrific. Again, Bill.
Thank you, Doctor.
It was a pleasure. You're a terrific guy. Thank goodness you're here to talk about it. And you're wonderful because I hope you took a couple of moments to take down some notes. I know you've heard this a lot, but darn it, do something about it. Be around for your family, especially if you're a lady. #1 cause of death among you gals. We want to stop that. Look, take care of your life. You only got one. That's it. So, Dr. Pass is saying, whatever you do it with passion. Take care of your life with passion. We'll see you again next time. Bill?